everyone. Thank you so much for stopping by to watch my presentation. My name is Natasha Aguilera. I am a second year physician assistant student at South University in West Palm Beach, Florida. What this video presentation is being made for is my capstone project, where I chose the topic on reducing the risk of preterm birth based on Healthy People Initiative 2030. This video will tailor more towards women in their first and second trimesters on ways that they can reduce their risk of delivering preterm, or what that simply means is before 37 weeks. But honestly, this video can be useful to you even if you're just trying to think of getting pregnant and just want to reduce your risks as much as possible and get ahead, or if you know someone who's pregnant and just want to pass the message along. In this video, I'll be giving information on what preterm birth means, why it is so important to reduce the risk and prevent mothers from having a preterm birth, also what effects it may have on your infant, and ways of reducing the risk as much as possible, especially within the first 2 trimesters, using evidence-based medicine and peer-reviewed data. There's also a questionnaire that I gave to some women in the South Florida region that I will go over with you guys, and an interview with a very special guest just to gain a different perspective. I've been conducting the survey for the past 4 months to assess if there are common risk factors in mothers who have delivered preterm or before 37 weeks. Due to my capstone project being on educating mothers, more specifically in the first and second trimesters, on the modifiable risk factors to reduce the risk of preterm birth, I felt it was important to ask women in my community of South Florida what their birth experiences were. Everyone who participated in the survey remained completely anonymous. They may have chosen to not answer any questions if they felt uncomfortable doing so. So far, I have received information from 35 women who have either already given birth or are currently pregnant. Out of 35 women, 22 were currently pregnant, with 6 in their first trimester, 9 in their second trimester, and 7 in their third trimester. Out of all 35 women, 5 had given birth preterm, resulting in a percentage score of 14.39%. Based on this survey outcome, that percentage score means that out of every 100 women, approximately 14 would deliver preterm. Some common risk factors between them were an average age of delivery of 34 years old, majority were of Hispanic descent, an average BMI score of 25 to 28, majority experienced bleeding or cramping during their pregnancy as a warning sign, and a rating of medium to high stress levels. All data received through this questionnaire was strictly used to assess real-life birth information from women located in the South Florida region. If you have not yet completed the questionnaire and would like to participate, please pause the video now. So before we get started, a little bit about me. I was born and raised in South Florida, but I love to travel. I don't currently have any children of my own, but I am a proud dog mom and a godmother to a very fun and wild 4-year-old boy. Before working in healthcare, I worked as a camp counselor, where I worked with children ages 4 to 17, and I've babysat children with ages ranging from newborn to 10 years old or maybe a little older. I started PA school in January of 2021, and I will graduate in March of 2023. To get into school, you must obtain a bachelor's degree, get tons of experience in healthcare, volunteer hours, and complete prerequisite courses before starting PA school. It is also highly advised to shadow people in the medical profession in order to determine if healthcare, 1, is where you want to be, and also if PA is the right choice for you. My program is 27 months long. The first 15 months are what we call didactic. So that is where we do all of our book learning. And the last 12 months are clinical rotations. So that's where we complete hours of experience out in the real world and put all the knowledge we just learned to the test. The best way to explain what exactly a PA is and what we do is we work in various medical specialties in a team with other physicians, surgeons, nurse practitioners, nurses, and many other people in the healthcare field. We prioritize educating our patients and we assess our patients in order to diagnose, treat, and prescribe medications that are appropriate to help them feel a little bit better. We are a master's program and need to pass a board exam certification in order to practice medicine. But enough about me. Back to what you initially came here for, right? Why did I even choose this topic? Educating women in their first and second trimesters of pregnancy on risk factors and prevention strategies has shown to reduce risks of delivering preterm. Unfortunately, there is a 10.1% risk of delivering preterm, according to the CDC in 2020, and it's getting worse. But don't worry, we're going to dive deeper into hopefully lowering that percentage score just a little bit as a community of us strong women. So let's get into what preterm birth is. To understand preterm birth, we first need to know the stages of pregnancy. The first trimester is the first 3 months of pregnancy, or the first 13 weeks and 6 days. The second trimester is the next 3 months, months 4 to 6, or in weeks, 14 to 26 weeks and 6 days. The third trimester is the last 3 months of pregnancy, months 7 through 9, or weeks 27 to 40. Some mothers are allowed up to 42 weeks to deliver naturally if prolonging delivery does not pose a threat to either mother or baby. Now, to go over some definitions you'll hear throughout the presentation, these definitions are created by the American College of Obstetricians and Gynecologists. Full term is considered a delivery of a baby between 37 to 42 weeks of pregnancy. Preterm is considered a delivery of a baby between 32 weeks and 36 weeks and 6 days. Very preterm is a delivery of a baby between 28 weeks and 31 weeks and 6 days. Extremely preterm is a delivery anytime before the 28th week. It may sound silly when I say, and 6 days, but the reason for it is to separate the start of the following week, which starts a new trimester, or starts a new definition in this case. So now that we know the stages of pregnancy and we talked about gestational age, now let's cover what's happening inside during fetal development. By the first month, all the cells that were initially within the egg and sperm have now developed into an embryo. Week 5, the 3 layers of development that will then further become different organs have now differentiated themselves, and the heart will start beating this week. Week 6, the nose, mouth, and ears are starting to take their shape, and their brain and intestines are starting to develop. By week 10, they have grown tremendously and are starting to look like a little person. Their skin is slowly getting thicker, and their arms and legs are now able to bend, with tiny little nails starting to form. At 13 weeks, which marks the end of the first trimester, your baby has developed their own unique fingerprints. At 14 weeks, their brain has begun to send impulses throughout their body, causing them to move in reflexes, make facial expressions, and sometimes you can see them suck their thumb. At 15 weeks, you can find out the sex of your baby through ultrasound. At 19 weeks, their 5 senses are starting to develop. At 25 weeks, they look like a little newborn with baby fat starting to fill out their body and hair coming in. By 26 weeks, which now marks the end of the second trimester, they have started to develop their lungs and are practicing breathing by inhaling and exhaling amniotic fluid. At 28 weeks, they are developing eyesight and can blink. At 31 weeks, they can now turn their head side to side, and their brain is continuing to grow along with the size of your baby. By 36 weeks, their lungs have fully developed, along with several of their other organs. At 37 weeks, you are now considered full term and can deliver at any time. They're just going to continue to mature and grow until the time they come out into this world. So why is it so important to prevent preterm birth, and what effects could it have on your infant? Infants born before 37 weeks of gestation have a higher risk of infections, developmental problems, breathing problems, and even a risk of death. According to the CDC's National Vital Statistics System, in 2020, the percentage of women delivering preterm was 10.1%, based on a census using records of all births registered in the United States. This percentage has remained fairly constant over the past several years. If broken down between states, Florida is ranked 16th in the nation with a preterm birth rate of 10.5%. The top 3 states with the highest rate of preterm deliveries are Mississippi, ranking first with a score of 14.2%. Second is a tie between Alabama and Louisiana with a score of 12.9%. And third is West Virginia with a score of 12%. The scores are provided and managed by the Florida Department of Health using population data provided from the U.S. Bureau of the Census. The data is only for pregnancies that end with a live birth. Compared to the rest of Florida at 10.5%, the percent of total births in the Palm Beach County in the year 2020 that were preterm births was 9.5%. In Broward County, it was a statistically significant high of 10.9%, and Miami-Dade County was 9.6%. Each state and county can be evaluated by you using the link at the bottom of the screen. The picture of the map of Florida, taken from the site, shows the relation between location and amount of preterm births. Ultimately, this is a public health crisis. Preterm labor can affect any pregnancy, but many factors have been associated with increased risk of delivering preterm. Some factors are genetic or non-modifiable, meaning you can't change it. But there are some factors that can be changed to lower your risk as much as possible. Prematurity is the leading cause of infant mortality worldwide. Preterm infants born before 37 weeks have the best chance of survival. Being born very preterm before 32 weeks account for over half of all infant deaths in the U.S., and 1 in 4 extremely preterm infants born before 28 weeks unfortunately pass during their hospitalization stay following birth. Being born preterm leads to loss of months of fetal development, which leaves the infant vulnerable to several morbidities. Prematurity can have long-term effects on the child, such as medical, developmental, or behavioral problems that may continue into adulthood or even become permanent. The more premature the infant and the smaller their birth weight, the greater the chance of complications they may have. The majority of children born preterm can live a perfectly healthy and normal life free from complications. But we're just going to go over a couple of the issues that may arise. According to my studies, using peer-reviewed articles, these are some of the possible complications that may come with delivering prematurely. The most concerning complications are breathing problems, due to the possibility of the lungs not being fully developed. We spoke a little earlier about the lungs starting to develop around the 26th week and not becoming fully mature until around 36 weeks of gestation. The area of oxygen exchange is performed at the level of the alveoli. There is a coating around the alveoli called surfactant, which protects them from collapsing against the high pressure and tension of breathing. As the lungs are developing, so is the amount of surfactant. If there isn't enough, then there's a risk of respiratory distress at birth. Fortunately, there is a steroid medication that is given to the mother called Betamethasone that is given to mothers between weeks 34 and 36 if they're at risk of delivering preterm within the next 7 days in order to help increase the amount of surfactant for lung maturity for your baby. Due to preterm infants needing to stay in the NICU, or Neonatal Intensive Care Unit, for the first couple weeks to months of their lives, studies have shown that preterm birth survivors performed significantly lower on language assessments, scored lower on measures of general cognitive functions, and showed an increased risk for behavioral and attention difficulties compared to those who were born full term. There is also an increased risk of infection due to their immune systems still being built. There has also been studies that have shown an increased risk of chronic disorders into adulthood. So, how can we prevent or reduce your risk of delivering preterm? Here are some risk factors that will make it more likely for you to deliver preterm. Educating women in their first and second trimesters of pregnancy on these risk factors and ways that they can prevent it has been shown to reduce the risk of delivering preterm. A study was performed on the risk of preterm birth among women who smoked at different intensity levels during their pregnancy. Low meant less than a pack a day versus high meant a pack a day or more. High and low intensity smokers had the highest odds of preterm birth when they were smoking during their first 2 trimesters. Mothers who only smoked low intensity within their first trimester before quitting had the lowest odds of preterm birth. This study simply showed the importance of smoking cessation prior to pregnancy, or at least within the first trimester of pregnancy, to have the highest chance of reducing your risk of delivering preterm. In another study, among women who experienced stress during their pregnancy, they were twice as likely to deliver preterm. Increased stress increases cortisol levels in your body, which may lead to earlier labor. The current method of screening for preterm birth includes a mid-trimester cervical length screening between 16 to 24 weeks gestation using an ultrasound. A short cervical length, which is about less than 25 millimeters using a transvaginal ultrasound, is shown to be a strong risk factor for preterm birth. The addition of progesterone supplementation and something called a cervical cerclage, which is a procedure to close the cervix, is found helpful in reducing risk and preventative treatment. Vaginal progesterone supplementation in the first and second trimesters has also been shown to be a great preventative treatment method for moms who have a known history of previous preterm birth. It is also recommended for mothers to wait at least 18 months to 2 years between pregnancies, meaning by the time they deliver to the time of conception, to reduce the risk of preterm labor by allowing your body and your uterus to completely heal from their previous birth. Many sexual transmitted infections such as gonorrhea, chlamydia, or syphilis has also been linked to increased risk of premature labor. Lack of prenatal care or continuing visits with your OBGYN provider may put you at an increased risk of delivering preterm. It is important to keep your body as healthy as possible and manage any prior chronic conditions, prevent gestational high blood pressure that can lead to preeclampsia or gestational diabetes, and just simply continuing regular prenatal care for a higher likelihood of an overall healthier pregnancy and delivery. Should there be any risk factors, your provider can help you prolong delivery as much as possible and monitor your baby until they have reached full term. We're about to watch a pre-recorded interview with a doula named Danina Avery. She's a birth and postpartum doula, a childbirth educator, and a breastfeeding counselor. She began her journey as a doula after the birth of her own child, where she used to doula herself and noticed what an impact it had on her pregnancy, her delivery, and her postpartum experience. She serves in all types of births, from home to birthing centers and to the hospitals. She's always looking for ways to build her knowledge to provide the most up-to-date, evidence-based care and support of her parents and babies. In the interview, we will find out exactly what a doula is, some personal experiences she has with preterm deliveries, and what advice she has for mothers. question I have for you today is, what exactly a doula is.
Okay, so a doula basically is a non-medical support person for someone who is pregnant. And depending on the extent of their expertise and training, they can provide anything from emotional support to physical support to childbirth education courses. They can teach them how to do newborn care, many lactation, so many things, basically anything related to parenting a baby.
Oh, it sounds a lot like a right-hand man type of thing.
Yeah, basically. So what's interesting is that the root word for doula actually means mothering the mother. And it turns out that, hundreds and thousands of years ago, women typically had their mother or a neighborhood old lady who would go to every birth, and then they would take care of the mother afterwards. They would help the mom learn how to latch and breastfeed. They would cook and clean for the mom, all of these little things, so that, when you say it takes a village, there literally was a village.
Right.
But as we have evolved farther away from that, which isn't necessarily a good thing, we've lost that connection. And so especially because there are many women who are waiting until their mid to late 30s to get pregnant. And a lot of them they don't have any siblings. And so they don't really have much experience in this area. So pregnancies are becoming more high risk. There's less women giving birth. There's less babies being born. And there isn't much of a support system. And that's where doulas step in, because we can provide that support and education and sort of try to fill in the gaps for these women who maybe their mothers are elderly and they're not able to help, or they live outside of the country, things that a few thousand years ago didn't happen.
So in that sense, what is the difference of a midwife to a doula?
Right, that's a great question. A midwife is very, very similar to a doctor who works as your OBGYN. They do almost every single thing that your doctor can do except surgery, meaning give you a cesarean. About 100 years ago, or maybe 120 years ago, basically all women gave birth with midwives, because midwives are able to attend any sort of childbirth, complicated or not. And when a mother needed a cesarean, which was less than 10% of the time, they would get transferred over to a surgeon who would perform a cesarean. I provide non-medical support, meaning I meet up with the parents during the pregnancy. I teach them all about the anatomy and physiology of pregnancy, of childbirth. I give them coping mechanisms in case they want to have an unmedicated or a low intervention birth. I teach them all of the medical terminology that there is to know about pregnancy and childbirth, so that if and when things do come up during the labor, like an induction or anything else, then the parents are a little bit well versed and nothing really catches them off guard.
Gotcha. So at what point do you recommend that someone should find a doula?
Typically during the second trimester, I think, is a great time, because it gives enough time for the doula and the parents to have a relationship, but not so much that there's risk of complications that could unfortunately terminate the pregnancy.
Because I know that it must be so difficult to have a newborn baby, and especially first-time moms that may not know exactly what they're doing. Having somebody with so much experience like yourself would be great to add along. How many births have you experienced and worked with?
I'd say probably about 50. They're awesome. They've all, pretty much all of them, have been extremely different from one another. It's crazy.
I imagine. And do you have any experience with any birth complications with any of those?
So the good news is that most complications actually happen during the pregnancy. And if caught early enough with proper intervention, they can be dealt with before the mother is in labor. In terms of labor complications, they are not common at all with proper prenatal care. And I think I've only really had one.
Okay. And do you have any experience with preterm births in that sense?
Yeah, one. Sorry, two.
Okay.
Sorry.
What common signs or factors did you notice with these women that may have led to their preterm birth?
None, interestingly enough. There were no signs or symptoms to tell you that they were going to go into early labor. Both of them were totally healthy women who had proper continuous prenatal care. And one of them went into labor at 35 weeks. And when she went into labor, that week, she was looking into hiring a doula. This is another reason why it's not great to wait last minute. But she decided to call me when she was in the hospital. Sorry, she wasn't in labor. Her water broke. So she was in the hospital. She was actually going to give birth at home. But when you are with an out of hospital midwife, if your water breaks or you go into labor before 37 weeks, that puts you into that high risk category. And so you have to transfer over to an obstetrician. And so the doctor came in, and I said to the doctor, like, she has a lot of hopes for this birth, and she's hoping to just be able to talk to you about it, and maybe you guys can come up with a decision. And so she said, I do not want to be induced. I want to just wait until I go into labor on my own. And he said, okay, well, we don't really want to induce you because you're at 35 weeks. I think she was actually 34 weeks. Okay. And he said, right now, I don't know if you know, but the last organs to develop for a baby are the lungs. Right. And so there's a big connection between preterm deliveries and cesarean deliveries and NICU use for babies for breathing issues. Right. And so he said, your baby's lungs are probably not developed enough to where they need to be. So just as long as we speak to the MFM, which is the fetal medicine doctor who provides prenatal care, they agree that it's fine, then I don't see why we wouldn't be able to wait. So she had daily NSTs, which is a non-stress test. They checked for the level of amniotic fluid, because if the baby runs out of amniotic fluid, that's an issue. And she went into labor a week later. So she was in the hospital for about 7 days. Went into labor, had a 20-hour labor, which is pretty average for a first-time mom. And everything was totally fine. The baby was great. The baby had gotten steroid shots through the mom during that week in the hospital. So that was one of them. And another one was actually with a friend. I was with her at her first labor, which was a precipitous birth, meaning the labor lasts under, I think it's like 8 hours. So hers was like 2.5. Wow. When she got pregnant the second time, we spoke about her not giving birth in anywhere that was long, like farther than 10 minutes away, except at 23 weeks, randomly in the evening time, she started feeling a little bit of cramping, and then she had a little bit of spotting, and then 4 hours later, at like 2 o'clock or something in the morning, she went into labor. Immediately she went back to the ER, because again, before 37 weeks you risk out of a hospital birth. And she gave birth like 45 minutes later to a 23-week-old preemie, who, thank God, is now about 3 months corrected age.
It's great to hear that they had, good births and their babies are healthy now, because I know that could be difficult. So, to your knowledge, from what you've learned, what do you typically educate your mothers on as far as preterm birth is concerned?
Yeah, I think some of the biggest risk factors, well, we have to consider a population, right? Right. The people who hire doulas are typically families who are more on the well-to-do side economically, right? They're not necessarily very wealthy, but they're higher on the socioeconomic level. And with that comes lower use of drugs, alcohol, things like that during pregnancy. So the biggest issues that I experience is lack of mobility and high stress levels. So those two things, dehydration is another one, which can cause preterm labor. But we talk about all of these things so much, like I really harp on it.
Great. So, what advice would you have to everybody else who may not be able to get to a doula or have access to a doula to help kind of prevent preterm birth? I know we mentioned the stress and hydration.
Right.
What other advice would you?
So for about a year, right before COVID hit, I was hosting free 1 hour classes on anything dealing with pregnancy and childbirth. And I did touch on those subjects. Unfortunately, there wasn't much of a turnout. And so I think that we can try to educate as much as possible. We can make our classes totally free, but if people don't want to learn, they're not going to reach out, and they're not going to hear you, and they're not going to really make any changes. I can try my best to talk about limiting drug use and alcohol use and exercising and hydrating and keeping stress levels low and having proper prenatal care so that you can catch things like preeclampsia early on and deal with it however you need to. But I don't know that it makes that much of a difference, because the people who want to know, they're already doing those things, and the people who don't want to know.
But the most that you and I can do is try and give as much education as we can.
Right.
So how would somebody find a doula for themselves?
The easiest way is to Google doula near me. I think that a really great way to find a good doula is to contact your local midwife or your local OB office, specifically the one that has a low cesarean rate, because they're usually very friendly with doulas.
Right.
Because there are studies that show that doulas help to reduce intervention rates during labor.
I have read that. A lot of evidence has shown that. The more support, the better the outcomes, I've read.
Yeah, continuous support makes a big difference.
Great. So how would somebody get in contact with you and obtain your services directly?
Yeah, through email or phone. I also have a website. My company is named Midsummer's Eve Doula Services. So I'm on Facebook, on Instagram, but if you just Google my name, Danina Avery, you should be able to find me all over.
That's great. So any parting words or advice that you have for any mothers out there during their pregnancy, for delivery, whatever?
Man, I could write a book about this, but if we're trying to keep it short, I think I would just encourage everybody to educate themselves and to always get a second opinion when something comes up, because healthcare in the United States is a business.
Right.
And there are some businesses that like to provide X type of service, and there are other businesses that like to provide Y type of service. And if you're looking for X, but you're at a Y business, you're not going to get what you want. And so get a second opinion, ask around, educate yourself on your options, educate yourself on your legal options when it comes to childbirth, because unfortunately, when it comes to, it's not this way around the entire world, but we are in Florida and we happen to have the highest cesarean rate in the country. And we didn't get there by accident.
Right.
So if you're getting an answer or a service that you're not hoping for, then I think it's really important to ask around and see if you can get something that fits more your desires, I guess.
Yeah, I mean, that's great advice. And, educating yourself is always the most important thing. You can't get the best if you don't know what is best for you at the end of the day.
Yeah, we don't really have a choice as to how birth ends up happening. Sometimes babies choose to come out a different way than we wanted them to, but being educated then helps you not have that rug pulled out from under your feet when that does come up. If an induction is mentioned or a cesarean comes up, whether it's emergency or emergent, It's good to know the medical terminology so you can have a proper conversation with your provider, and you're not waiting until this last second. You're like, wait, I've never heard of this. What is it? I have no idea what's going on, because that can be a very scary feeling.
Right. No, I believe.
So education and support.
Well, thank you so much for answering all of my questions. And, I'll definitely put your information out there in case anybody wanted to reach out to you and look into your services. And, hopefully this tells a lot more people what a doula is and what they do. And maybe it'll be in the cards for them to be able to have a doula with them and just reduce those risks of preterm birth, reduce the risks of any complications, and, have good a birth as they can. So I appreciate
100%. My pleasure.
I hope you enjoyed the information provided during this presentation and the interview with the doula. The goal of this video was to raise awareness of the importance of reducing preterm birth and provide you with the ways that you can reduce your risks, especially in the first and second trimester of pregnancy. To recap, try to quit smoking and drinking alcohol before your pregnancy, or at least within the first trimester. Try to decrease your stress levels and build stress-relieving habits early on in your pregnancy. Make sure to attend all of your OB/GYN appointments on your scheduled times and follow up on your ultrasound appointments. Also, try to make sure to remain safe sexually while pregnant to avoid sexually transmitted diseases, especially in the beginning of your pregnancy. It is most important to try and build these habits within the first 2 trimesters while your fetus is still growing and developing. I'm going to leave my contact information at the end and supply you with some resources I have found if you wanted some more information about preterm birth and how to prevent it. Please leave any comments, questions, or concerns below in the comment section. Thank you so much again, and I hope you have a great day.